Jagannathan Ji, President, Board of Unani, Siddha and Saurikpa, National Commission for Indian System of Medicine. Then respected delegates, senior practitioners, students, and especially members of the organizing committee, my greetings to you all, Rishtele. And first of all, I'd like to thank the Namgyal Institute of Tibetology, Gangtok, and also the National Institute of Saurikpa, Leh Ladakh, for organizing this national workshop on Saurikpa. And today I've been asked to talk about the role and contribution of Chakpuri Tibetan Medical Institute for the conservation of Saurikpa. So first, I'd like to tell you very briefly about the history of Chakpuri. So first, in 1430, the great Tibetan sage Thandong Gyalpo built a shrine on the hill Chakpuri, which was revered as the sole mountain of Bodhisattva Vajrapani, and named the hill as Mengal Ri, which means mountain of medical triumph, thus blessing and prophesying the flourish of medical studies at the site. Then precisely in accordance with the explicit wish of the great fifth Dalai Lama, a monastic medical college was established on Chakpuri Hill in 1696 by the regent Desi Sangye Gyatso, who himself was an expert, and he authored several treatises on medicine and astrology. It remained an important medical institution and was responsible for the spread of practice of Tibetan medicine in Central Asia also. However, the Chinese occupying forces completely destroyed the institution along with its library of precious medical texts in March 1959. As we have seen in the previous presentation by the director of Menzikhang, like you saw, by the director from the National Institute of Saurikpa, like Dr. Padma Gyurmila, he was showing many Thangka paintings which were originally from the Chakpuri College in Lhasa, Tibet. And there now stands a communication tower. So this is what is left of it there today. And like Chakpuri Hill, as we see, it's just across the Potala Palace in Lhasa. Then the late Dr. Tagore Rinpoche, he became very concerned about the Chakpuri lineage of physicians as it was on the verge of disappearing. Rinpoche was one of the very few practicing doctors who managed to escape from Tibet. So he made up his mind to preserve and promote the sacred lineage by setting up an institution in exile. And after years of planning and endeavor, Rinpoche finally managed to establish Chakpuri Tibetan Medical Institute in 1992 at Darjeeling, West Bengal, in commemoration of the Lhasa Chakpuri, with the blessings of His Holiness the Dalai Lama. And the main mission of Chakpuri is to teach, preserve, and promote the science of Saurikpa. So in order to conform to the government rules and to bolster the function of the institution, Rinpoche constituted a board of directors. The non-profit charitable organization was registered under the West Bengal Societies Act as Chakpuri Tibetan Medical College Society. Now, Chakpuri is a full-fledged institute with its head office at Darjeeling that coordinates the functions of its three pillars: the college, the pharmacy, and clinics. The college here, which we see, Chakpuri Tibetan Medical College, is situated presently at Tagda Cantonment, near Darjeeling. The college offers Member Kachupa, a Bachelor of Saurikpa Medicine and Surgery, a 5-year extensive course followed by 1-year internship. So, since the Chapuri lineage lays emphasis on the integrity of medicine with spiritual values, throughout the entire period, emphasis is also on the study and practices of medicine Buddha, Dharma teachings related to healing according to the Yudhongingti practice and also medicine making. And the second department which we have is the pharmacy, as which we see here. So this is located at Salugara near Siliguri. And now to come back to Chapuri, so without mentioning something about the works of Trogar Rinpoche, it would be incomplete, because we could say that the present Chapuri, which is re-established in Darjeeling, is synonymous with the name of Trogar Rinpoche. So he worked for much of his life in re-establishing Chapuri, and then he was also one of the pioneers who were very instrumental in like sort of introducing Tibetan medicine to the Western world. And here, as we see, it was the first international convention on Tibetan medicine, which was held in Italy in 1983. And in the middle photo, which we see, he was also invited to Bhutan. They have one medical college in Bhutan, which was then known as the Indigenous Hospital of Traditional Medicine. And he was invited there to conduct the examination through the early 80s till the early 90s. So he was the one person who had to set up the question paper, conduct the examination, check the question paper, check the oral examination. Everything was done by him in the early 80s and early 90s, through the 80s and early 90s. And now, of course, Bhutan, as is an independent nation, they have their own full-fledged medical college with lots of practitioners and medical clinics set up throughout the country. And Rinpoche, as you see here, again, this was also, he traveled throughout the Himalayan region, and here, as we see, he had sort of also taken a lot of initiative and to pass on the lineage of the teachings of medicine to the younger generation and to the people who are interested in it. And then this was a photo taken in Ladakh. The upper one which was taken in Ladakh in the mid-90s. And then the second photo which we see is after the completion of Rinchen Sothel in the year 2002. So Rinchen Sothel, as most of our practitioners would know, this is the detoxification and process, which respected Professor Bajidar Jamdila would be speaking in the next topic of the heavy metals, of the precious metals of gold, silver, and also mercury. It is a very tedious process by which a special compound, mercuric sulfide, is made, and then which is said to be very effective for serious ailments. And then, of course, as most of you may have experienced it, in the last 2 years during the pandemic, so we had very good results with the precious pills. And then, these are the photos of the graduates of Chapuri. So here, as you see, that the first 3 batches of students of the college gave the examinations at Dharamsala along with the students of Mensikang and obtained the degree certificates at par with the Mensikang candidates. Then after the recognition as a full-fledged medical college by the Central Council of Tibetan Medicine, the examinations were conducted at Talpa campus. However, in order to maintain the academic standard and to have fair examinations, question papers are set by teachers of other colleges and other senior doctors. So you see the different students here. And then this was the 7th and 8th batch of students who just graduated recently. The convocation ceremony was in fact held on 6th May 2022, which coincided with the the 326th anniversary of Chakpuri Lhasa. So altogether, there were 21 students who have graduated, or 21 new doctors. Here, like as you see, like this is the different activities of a Chakpuri college. So as you see here in the picture, of course, some of the pictures from the classes, and also we also sometimes invite like experts in different fields, maybe some acupuncturists or whatever, and then they given some short courses to our students. And also like we also encourage our students to participate in the process of medicine making, so that would enable them to be fully independent later on. So these are just some pictures about the students undergoing the written examination. And like during the course of their study, again, we give a lot of importance in their the practical training, and like once a year we have the medical identification excursion up in the mountains. So in the first year, they go for the excursion around the nearby places. Then in the second, third years, then they go to other places. So these are just some pictures of our students, guided by senior doctors from the pharmacy, who take them for their annual medical excursion. And then here you'll see a picture like a jigsaw puzzle here. So then these are like when the students are just undergoing the examination of identification of different herbs. So then it's like just scattered around, and then they have to identify the different herbs according to the numbers, how it has been labeled there. And as I've been mentioning before, like we also give a lot of emphasis to the spiritual aspect, because the speciality of Chakpuri is the blend of medicine and spirituality. So like after completion of the 5 years of 5 years of studies, so at the start of the internship, so they go they like undergo the Yudhanyingthi retreat. So this is a picture of that of the students undergoing the Yudhanyingthi retreat. So we say like this practice is considered of vital importance for the inner development of a physician. Of course, like we just form the give the support to them and introduce to them, so that they know or what the practice is about. And then of course it's up to the individual to develop the practice, integrate it into oneself. So this is after the completion of their month-long Yudhanyingthi retreat. And now, going back to our third pillar, it's the clinics. So this is a picture of one of our clinics. So at present, Chakpuri has 4 medical clinics at Darjeeling, Kurseong, Tagda, and Salagara. The amount that we charge is bare minimum. These services are offered on a sliding scale to patients depending on their means, and are free of charge to the real needy. Besides the above branch clinics under Chakpuri's management, doctors who have passed out of Chakpuri are successfully running monastic, institutional, and private clinics at many places around the world. And sometimes we also conduct free medical camps and mobile camps in the region. So these are pictures of some of the free medical camps which we conducted in the last 2 years during the time of the pandemic. And then this is like one of our Chakpuri alumni who's practicing in Holland, in Amsterdam. And the name of the clinic is Chakpuri Tibetan Health Center. Now going back to the pharmacy, Our pharmacy department of Chakpuri produces different herbal medicines, and it is located, as I said to you, in Salugara near Siliguri. The construction of the new pharmacy building was mainly sponsored by the Webb Atten Foundation of Holland and others. The formulas of medicines are derived from the fundamental text and from practical instructions of various scholars. The manufacture of the herbal pills is a tedious task as it involves intensive procedure of purification and compound. Pharmacy department also manufactures herbal products for rejuvenating body and skin based on traditional Saurabha medical system. Chakpuri's herbal massage oil, pain relief oil, eye drops, skin ointments, incense products, and herbal tea have become very popular. And this is a picture of the pharmacy where the compounding of the different of our medicines are done by the chief pharmacist. And these are just a timeline of Chakpuri when we celebrated our Silver Jubilee celebration in the year 2018 with the guests who had gathered there, and then just an exhibition of the different herbs and the medical Thangka paintings which I mentioned before, which were originally from Chakpuri, but this was a reproduction which was copied and I think it was at Burit or somewhere in the former Soviet Republic of former Soviet Union. And after the collapse of the Soviet Union, then now we were lucky enough to find these paintings, as the original one in Chakpuri was completely destroyed. This was just a cultural program by our students during the Silver Jubilee celebration, and guests, and then group photo with the staff, doctors, alumni, students of Chakpuri. And this was just a group photo when the Sikyong of the Central Tibet Administration visited Chakpuri last September at a college. And though here, as you see, like in the upper photo, certificates were awarded to Chakpuri doctors after completion of 2 years of internship and further 3 years of intensive training, first in the year 2003 and also in the year 2004. So these were not officially named as PG certificate or Menrapa certificate, but this was given to those doctors who completed that training of 5 years. That's 2 years of internship and 3 years of intensive training. Now, Saurabha medical system, which has been officially recognized under the regulatory control of the National Commission for Indian System of Medicine under the Ministry of Ayush, Government of India. Now, this recognition of Saurabha will facilitate legal security, quality control, and accreditation of medicines and practitioners of Saurabha and medical colleges. It also means that we have to upgrade our existing infrastructure in order to get the government certification. So with unstinted help from our supporters, with dedication of our staff, and with grants from government, we feel we can do it. And also taking this opportunity, I'd like to urge the Ministry of Ayush and also the National Commission for Indian System of Medicine to kindly support the Saurabha system of medicine and to nurture us so that the Saurabha can grow and flourish and be of benefit to humanity. So once again, I'd like to thank very much to the organizing committee of this workshop. Thank you very much. Thank you, sir.